Hi everyone, my name is Sarah and I chose to do my research throughout this semester on compassion fatigue. Compassion fatigue in acute care settings can lead to nurse burnout, poor staff retention, poor patient care, and can negatively affect a nurse's home personal life outside of the hospital. Oncology nurses care for patients that are suffering both emotionally and physically. Due to the nature of care oncology nurses provide, they tend to develop caregiving relationships with both the patient and the family due to frequent hospitalizations. Compassion fatigue experienced by a nurse, or his or her risk for compassion fatigue, is a consequence of social interaction within a given environment. This evidence-based practice presentation is designed to explore factors leading to compassion fatigue, ways to combat fatigue, and the inverse relationship between compassion fatigue and job satisfaction. My PICO question is related to compassion fatigue and oncology nursing. Does compassion fatigue experienced by oncology nurses providing for cancer patients have a negative result on their personal lives or influence their quality of care? To break down my question, P would be oncology nurses in an acute care setting. I would be compassion fatigue and burnout, how it affects oncology nurses' quality of care, personal lives, and work environment. C, experience, job satisfaction, supportive work environment, and self-care. O, does the supportive work environment, self-care, job satisfaction, and reward balance the fatigue and burnout associated with caring for those traumatized and suffering? The literature search was done through the PA College Library. I used the EBSCO and the CINAHL databases, generally using the keywords compassion fatigue, oncology nursing, burnout. Sometimes I would use just compassion fatigue and burnout, sometimes just oncology nursing and compassion fatigue. I generally, at that point, would also include within the search database that I did not want to search for any articles no later than 2014. And it was also really helpful that you could check off that you wanted peer-reviewed and journal articles to narrow down your search findings so you're not digging through a bunch of literature that's not going to qualify for what you're looking for. So through these search options, I came up with 5 peer-reviewed research articles that investigated compassion fatigue and oncology nursing specific. I chose specific for oncology nursing because I work on an oncology floor, so I wanted to see how I could relate to the data that was represented in the studies, and then how I could incorporate things that I learned throughout my research into my own caring practice. My literature search included 4 quantitative articles and 1 qualitative article. Articles were chosen that were primary sources only, and my articles were actually limited to just North American research. I opted to stay within the realm of North America and not go into a more broader search of an international database. So I limited everything to just the United States or United States and Canada. Reflections regarding my literature review. I found Open Athens very easy to use. I found selecting full text only helped to narrow down my search instead of sending me to articles that looked interesting and would only be the abstract or would be a link to go to another website then to pay for the article. So by being able to select full text only, it really helped to narrow down my search and also decrease the amount of time that I spent looking for an article. Another reflection that I have would be the ease of finding articles within that 5-year time frame. Again, I found some really great articles, but they would be from the early 2000s, and even though the topics and article dynamics were what I was looking for, the research and the literature was not from within that 5-year time frame. So it was really nice to be able to check the, from 2014 and above. And then I chose to use articles focusing on oncology and compassion fatigue, again, because that is the realm of care that I provide, but not saying that compassion fatigue is limited to only oncology, because for any nurse that works in any specialty dealing with trauma or suffering, or poor work environments, staffing ratios. Compassion fatigue is very alive and well. It doesn't have to be just specific to oncology. 5 research articles that were chosen for this project all used various interview styles to collect the research. The professional quality of life scale was used in 4 out of the 5 research articles. One thing I found interesting was that men were very underrepresented in all 5 articles that I read. I think 2 of the 5 may have had 1 male participant, whereas the rest were all female participants participating in the research. And burnout, the consensus throughout the course of my articles is that it was caused by not so much the nature of care as it was by factors such as insufficient resources, poor work design, poor staffing ratios, and management conflicts, which I don't know if that was comforting or not, because I could relate. Burnout a lot of the times is not caused so much, at least from my perspective, from working with oncology patients, because that to me is very rewarding, but it's more so because we don't have the resources, or we're short-staffed and people are being pulled thin, and nursing care and ratios are becoming unsafe, as well as management conflicts amongst the staff. Only one of the 5 articles offered a table to compare and contrast the differences between compassion fatigue and burnout. Press Ganey scores were evaluated to observe patient satisfaction after an interventional debriefing was imposed following patient deaths for staff, representing a measurement with high reliability. So this was something I found to be really interesting. One of the articles that I read, Zajac et al. Was the article authors, was they were looking at nurses who were struggling with grief following a patient passing. And as a result, Press Ganey scores were evaluated the year prior to the study, and then what they did was there was a concern for a relationship between staff grief following a patient passing and patient satisfaction scores. So what they did was they started a intervention as a debriefing after patients passing for staff to sit together and share their emotional responses to losing the patient. And they all mentioned that it was very helpful to know and to talk through their experience and the emotions that they were experiencing. It was helpful for them to process and to be able to move forward. And the end result was the Press Ganey response for patient satisfaction was better than it had been the 3 years prior in the same quarter. So it was measuring the same quarter Press Ganey scores, but it was better after the intervention of having the debriefing session following patients passing. Compassion fatigue is not limited to cancer care. However, literature indicates that it occurs frequently in oncology. So I did pay mention to this before, is that even though I chose to research compassion fatigue and oncology nursing, that was more specific to the type of nursing that I do. But again, it's not limited to just oncology. There's obviously for trauma, for the ICU or the IICU, the emergency department, all different aspects of nursing care that we're all caught out for differently. We all experience our own different kinds of trauma and burnout and compassion fatigue related to the type of specialty nursing that we do. So I just wanted to touch base again that it's obviously not limited to cancer care, but it does, however, occur frequently for oncology. One qualitative article was used, and open-ended interviews were used to obtain a grounded theory approach to compassion fatigue, and the end result is apparent job satisfaction. One of the things that was important is employee satisfaction. So according to the article written by Morrison and Coral, the well-being of the nurse goes largely ignored. I think a lot of us can identify with that we're so focused on patient care, patient care, patient care, but we're not concerned or putting our focus or emphasis on making sure that we as caregivers are also involving ourselves in self-care and making sure that we are taking care of ourselves. We had a really great chaplain that was designated for our 8-line floor for a good couple of years, and she was so focused on making sure, well, what are you doing for yourself? What have you done for yourself lately to kind of give yourself a break, take yourself away from what you've been stressed out about, focusing on, and do something good for yourself. So I feel that we as nurses focus so much more on the caregiving and not turning that focus back on towards ourselves and reflecting that onto ourselves, that we need to be providing care for ourselves as well. The staff, as I had mentioned, found these debriefing sessions in the Press Ganey article. They found them very helpful, and the patient's perception of care was higher compared to the same quarter in the previous 3 years. And then organizations could offer self-care initiatives to help with staff morale, job satisfaction, and rejuvenating the energy and compassion required for not just oncology, but all aspects of nursing care. So I recently found out that, and something I need to investigate a little bit more, I believe, is that LGH's healthcare you can actually use towards acupuncture and massage therapy. So you would just need I guess it's a referral from your primary care, but over at the ABBCI, they offer both acupuncture and massage therapy. So, like I said, it's something I need to investigate a little bit more, but these are two really incredible options for helping to keep ourselves safe and providing that safeguard for ourselves to make sure that we're taking care of ourselves as well, right? Putting all this energy into our patients, but we also need to be putting energy into providing care for ourselves. To reflect back on my work, a common theme in all 5 research articles indicates that job satisfaction and reward of caring for those suffering was more significant to the nursing participants than compassion fatigue and burnout. Something that did stand out to me was a specific direct quote from Zajac et al. That organizational factors to reduce compassion fatigue should focus on caring for the caregiver, which is what I was just talking about. And then it's just as important to take pride in providing self-care as well as patient care. So we need to remember to take care of ourselves as well as our patients. These are the 5 references that I used to do this evidence-based practice. And I hope you enjoyed my presentation. Thank you.